Less than 1 in 5 eligible Americans have received the recommended updated COVID-19 vaccine.
But additional doses of this booster were given the green light for some adults by the FDA and CDC.
Across the U.S., COVID-19 cases, deaths, and hospitalizations continue to trend down, according to the Centers for Disease Control and Prevention.
One of the reasons why things are so much better now than where they were a year or two ago is because almost everybody now has some level of protection.
Dr. Frank Esper with Cleveland Clinic says the protection is either through a prior infection or vaccines, but early data suggests protection has started to wane from the bivalent booster, which health experts say protects against the original strain of the COVID-19 virus, Omicron, and its spin-offs. That's why the FDA has updated its guidance for the most vulnerable to the disease, allowing people 65 and older to get an additional dose of the Pfizer or Moderna bivalent vaccines now, as long as it's been 4 months since their last one. And most people with certain degrees of immunocompromise can get a second dose of a bivalent vaccine at least 2 months after the last one.
What we're trying to do with our vaccination response is to make sure that everybody's antibody levels, remain protective so that they can fight off the infection.
For immunocompromised children ages 6 months through 4 years, eligibility for an additional bivalent vaccine will depend on the vaccine previously received, so talk to a doctor. Another big change is that most unvaccinated people may now receive a single dose of a bivalent vaccine rather than multiple doses of the original single-strain vaccines. For Health Minute, I'm Mandy Gaither.